clearly, and if you can also hear me speaking clearly. That's very important. So great. Thank you very much, Betty, for that. So on behalf of LMSK, allow me to invite our presenter for today. We have an exciting topic where it's clinical laboratory mapping. Under it is redefining efficiency as a key tool in quality analytical work. So our presenter today is Mr. Agri Marube, who is one of our members in the profession. He's very experienced in matters clinical chemistry. And with that, allow me to call upon Mr. Agri. If you can hear me, you can kindly affirm that you can hear me clearly so that you take over. Mr. Agri, over to you.
Yes, Mr. George, I can hear you clearly.
Great. Thank you very much. So you can take over and start presenting.
Thank you, my colleagues. I appreciate this forum so that we can share ideas and also learn and also gain our CPD points. You are welcome on board so that we learn together. Our topic today is clinical laboratory mapping. In a nutshell, we are going to check on issues with efficiency. We are going to, the subtopic is redefining efficiency as a key tool in quality analytical work. Pertaining to clinical laboratory mapping, we are going to look at a number of things. We are going to look at the definition, and also we are going to look at workflow charts in laboratory mapping. We're going to look on at key aspects of laboratory mapping, as well as lean principles in medical labs, and also check on workforce management in clinical labs. And we're going to look at how clinical laboratory mapping is patient-centric. How can it enable us to increase, to make sure that we have our the faster TATs. We are going to look at the role of clinical mapping as an efficient tool at point of care, and also as a life-saving measure, as well as an enhancer of quality assurance in our clinical labs. We are going to look at the flowchart and the phases that are involved therein, especially in the analytical, pre-analytical, analytical, and post-analytical processes or phases, what they entail, especially in the process mapping. The process is one of the key quality assurance essentials that are prescribed to us by the World Health Organization, as well as the ISO 15189. And this one enhances our efficiency as well as quality management in the clinical labs. So as an introduction, the healthcare landscape is shifting towards patient care, patient-centered care. This emphasizes the importance of patient involvement in clinical health decisions. Now, this transition demands secure and efficient health data exchange throughout the care continuum, making laboratory results a crucial component of patient management. So in this, we are going to define what the clinical laboratory mapping is. The clinical laboratory mapping for efficient workflows involves visualization of the entire sample journey from the pre-analytical, analytical, and to post-analytical phase. And this visualization enables you as a medical laboratory professional to identify bottlenecks, redundancies, and wasted movement of the sample flows, of wasted movement of the sample processing. Typically using flowcharts to design or redesign processes for better resource use, faster turnaround, and improved accuracy. Often by creating dedicated zones, automating tasks, and ensuring clear communication and layout. So this is basically what clinical laboratory mapping is. So in this visualization, we have to identify the bottlenecks. If they are there, if at all they are there, we have to identify them. And we identify the redundancies that are there that makes the system clog up, and we are not able to move forward. There are issues about wasted movement that you are not able to move because of technical glitches that hinder you from progressing. And this is what we want to eliminate by understanding what clinical laboratory mapping is. As a continuation of the definition, the clinical mapping means creating detailed picture of laboratory resources, laboratory equipment, staff tests to understand, improve, and coordinate services, especially to ensure quality testing, helping the personnel involved to see where services are strong and where gaps exist. So you have to make an audit. What do you have? Which equipment do you have as a professional, as a staff on duty, or as a staff, especially in your area of management? What do you have? How many staff do you have? What is the workload, or how many tests do you handle per day? And you need to understand now, in all these data that you have about the equipment, staff, and tests, you understand what you have, and you improve the resources that you have, and coordinate services efficiently so that you can handle the tasks that you have with the resources you have at hand. And in a nutshell, here you have to consider that in this coordination of efficient services, you have to make sure that you churn out quality data, and that is basically involving the results that you release to the system. And this system is about the system. It involves the users. The results are churned out to the users. Those are clinicians, the patients themselves. Then after identifying all this, it will help you to be able to ensure that the services are stronger, and also see where gaps exist. It's about strategic organization, not just physical processes. So it also involves this strategy. How do you coordinate your work? How do you manage, especially when you have a heavy workload and you need to deliver? How do you strategize your work? We're going to look at workflow charts in laboratory mapping. The purpose of workflow chart is to make processes transparent and easy to follow. When each step is clearly laid out, it becomes easier to, one, identify inefficiencies like unnecessary steps or repeated tasks. It will it will make sure that it's easier for you to improve turnaround times by spotting delays or slow handoffs. It becomes easier to ensure consistency by aligning with standard operating procedures. It also becomes easier to support training and onboarding, making it easier for new staff to understand how things work. It makes it easier to maintain quality and compliance, especially during audits or inspections. So workflow charts in laboratory mapping are very important. So in making our work easier in the clinical labs, it doesn't matter whether you are working in a very busy lab where you have a huge patients and or test turnover, you are likely to face inefficiencies in whichever kind of lab that you have, whether it's complex or simple, because you are not organized. So laboratory mapping helps us to organize ourselves. And in this organization, in simple terms, it will reduce inefficiencies, because there are times that we constantly repeat certain tasks unnecessarily, and the turnaround times are prolonged. So this, in this, we spot these repeated tasks that we need to avoid, especially, for example, we are checking on patient sample labeling. Maybe we have maybe 4 staffs in the lab. Each and every one of these staff, they keep on checking whether the patient sample has been labeled correctly. Don't you think that it will prolong turnaround time? There has to be someone who maybe is tasked with triaging samples or checking whether the patient samples are correctly labeled as per the standards that you have set as a lab. Now, these processes have to ensure that you are aligning your operations with the standard operating procedures. What do standard operating procedures require of you, especially in sample collection? How do you prepare your patients? How do you make sure that the correct samples are channeled towards the correct stations? How do you ensure that the sample that has been prepared for analysis is meeting correct standards? Is there hemolysis? Are there clots in these samples? Which is the correct sample for a specific analyte? Now, this has to be done at one spot and with a prescribed person who is there to check everything is correct before the sample is analyzed. But when you leave it to be handled at random, there will be misses somewhere. There will be gaps somewhere. So it's crucial for us to make sure that every task and every part of the process is clearly identified, with the personnel handling the tasks identified too, for us to move efficiently. We are going to check on key aspects of laboratory mapping, and these are, for instance, we have to check on digital transformation, laboratory information system, or laboratory information management system. And also we are going to look at the lean principles, and this involves eliminating waste, removing bottlenecks, and standardizing procedures. The strategic design of our processes, where we optimize the lab layout, the lighting, and proximity protocols to reduce the movements and distractions. How do you optimize your work? What is the layout of your lab? Have you organized your lab for efficient work? Yes, how do you move from one point to another? Is there proper lighting in the lab? The proximity of tools. For instance, you have an analyzer that you have to move across. That analyzer is the one maybe is used for biochemistry work. And then when we're moving from the sample triage area, where samples are identified and shipped for analysis, the distance is too long, and you have to move along. You have to come across so many analyzers, and there is no clear way out for you to move efficiently to this station. What happens in this case? The spot is the analysis area is distant. Then how do you organize movement from this collection point to the other? Do you have a way in which the samples are transported to that area of analysis? Maybe you have an area whereby hematology analytical work is done. There is a sample roller mixer maybe several meters away from the hematology analyzer. How do you move this sample that has been correctly mixed to the hematology analyzer? Or do you have automated platform where these samples is relayed there? Or you have to move physically? This is what we mean by proximity. Now, in this proximity and methodology of moving these samples from one place to another requires you to reach at a decision. Do you move them automatically, or do you use manual movement? And this is what we want to reduce. We want to reduce sample movement. We want to reduce movements and distractions. We need to check on quality and accuracy of our processes. Quality management systems have to be up to date to ensure instrument calibration and error correction. We need to adopt automation in some tasks, because this one reduces human error through adherence to protocols. For instance, at this point of automation, there is complex automation to simple automation that we can adopt in the lab. For instance, a sample has been collected for hematology analysis, and we need to run a CBC. We can have simple automated devices for mixing these samples rather than mixing using our hands. And this one will reduce our TAT, and also the sample is mixed efficiently. What about vortexing in clinical labs? Maybe you want to mix a sample thoroughly that you've reconstituted for a certain procedure, and you are told that this sample has to be mixed thoroughly about 15 to 20 times or 10 to 15 times. What do you do? Which system have you adopted in your lab? Maybe having a simple vortexing device can help you, because this device will make so many vibrations to make sure that the samples that have been mixed, or the analytes and reagents that have been mixed, are mixed thoroughly and efficiently. So these are simple tasks that we can automate, simple devices that we can be able to buy. And also in complex labs, we can be able to acquire complex devices that can help us to reduce our turnaround times. We need to know people and culture, especially when we are doing mapping. We'll talk more about that. Change of management is also a key tool or a key aspect that we need to look at. And this involves staff, clear communication, and training for successful technology adoption. So continuation of key aspects of laboratory mapping, we need to ensure that we have resource inventory. You need to catalog lab equipment and processes. You need to check their locations. You need to check on capabilities of the equipment. What tests do they do? You need to check on the location of this equipment. You need to check on the processes that are involved in the respective stations. You need also to check on the personnel. Who are these personnel who handle this equipment or these processes? As I've stated earlier, that laboratory mapping does not only involve physical processes, it involves also the systems. There are also a key aspect involved in laboratory mapping, which is network analysis. You need to map how the labs connect and refer samples, improving workflow efficiencies. How do you refer your samples from one laboratory to another? Do you have external referrals or within lab referrals? Maybe it's from biochemistry department to molecular, from routine lab to special chemistry lab, from routine chemistry section to molecular lab section, or to special chemistry lab. Now, how do you refer your samples, and what bottlenecks are there in this sample referral? How do you improve efficiency? How do you improve flow? Workforce management also involve balancing automation with skilled personnel. And you need to consider that patient-centric care is very key. So you need to improve your TATs. Like, for instance, when we are talking about patient-centric care, how do we handle especially critical results? Which samples do we give high priority? The priority samples, especially on critical conditions, critical situations of patients, the samples that are prescribed to be of high priority, how do we handle them? Is there an SOP that clearly states how we should handle such a samples, such a critical processes? How do we handle them? We need to consider patient portals. You need to empower your patients with remote access to resource. We are in an era that is advancing towards adoption of artificial intelligence. IT, we need to be IT savvy. If we don't move in tandem with the growing need of embracing technology, we are going to be left behind, because in some laboratory or clinical healthcare settings, we find that we are handling patients or clients who have varied needs. For instance, in big towns or cities, there are patients who need maybe who might need to check their results in a certain platform or a certain portal. Instead of this patient breaking off from work and coming to the hospital or to the lab to check for the results, the patient can access the results through the portal. This will enable you to be at a safer position because of patient influx. Some of them need to check results that they could have checked in the portal, and also this in this remote access. Do these patients have clearly reported results that involve also some explanations or recommendations that the patient can the patient needs to digest on these results? Is there any communication on urgency of these results, especially on seeing the clinician, so that the patient is well informed on the steps to take after accessing these results? The patient portals have to actually be customized for patient consumption. Of course, there is also customization for consumption by the doctors or other clinical personnel on what they can do to certain results. Are they able to make quick decisions based on how the results are presented? Are they able to understand what the results entail? Yes. So how are our results churned out? How do we report? Do we just report a value with the reference ranges? Do we have recommendations? Are we able to advise on some technical points on certain results? So this is what we need to empower our portals, whether it's clinician portals, whether it's patient portals. We need empowerment in this areas. Point of care testing is another consideration that we need to consider. So do we need to bring testing closer to the patient for immediate results? For instance, we are handling blood gas analysis. We are handling blood sugar testing, ketone testing. How closer can we bring this testing to a patient? Have we embraced automation and AI? In sample mixing, for example, sample preparations I've talked earlier, do we have automated processes, especially in checking of samples, especially sample triage? Do we have automation in sample labeling? Do we have barcoding of samples? How do we handle these complex processes from simple to complex labs? Which level of automation have we embraced? A continuation of laboratory mapping. Laboratory mapping involves integration of systems for seamless data flow. Some of them can be real-time monitoring, and this enables us to reduce errors. Workflow automation automates routine tasks like sample registration, tracking samples, labeling, and resource entry, which significantly reduces manual errors and improves efficiencies. For example, I'll give an example, especially in workflow automation. For instance, how do you register your samples? A sample has been received and well labeled. Some labs can opt to do manual labeling, like writing by a pen, especially the details, the particulars of a patient. Which parameters do you write, especially in the sample? How accurate are these labeling techniques? Some labs will decide to have a barcoder whereby a sample is identified and there is labeling. Some labs will opt to do physical labeling by hand and also by barcoding. But now, in registration of samples, some labs will opt to scan that barcode to register that sample, while others will go manual. You register the sample, you write everything on a book. Now, how does this increase your efficiency, or how does it reduce your efficiency? So these are things that we need to put into consideration. How are you able to track your samples? From sample reception, who received that sample, who analyzed the sample, who released the results? Now, results entry, who released who entered the results into the system, and who authenticated the results for final release to the users. Now, when we look at all these processes, we are able to identify the bottlenecks, the gaps that are there, or the strengths that are there. And in these gaps or bottlenecks, we are able to pinpoint where problems are, and we are able to solve problems that arise, and also make sure that we streamline our processes. In laboratory mapping, we ensure data accuracy and management. There are many things that I have highlighted, like automation, labeling, registration of samples. Now, is it automated? Is it manual? How do we consider? If it's manual, do you have a dedicated personnel who handles the manual labeling system or the manual registration system? Now, in this, we need to consider data accuracy and management. Which system serves our purpose, especially in a busy lab? Which system serves our purpose? Is it automated system? Are you able to handle large volumes of data in a secure way? Do you have databases that you are able to use to analyze that data very fast? Ensure data integrity and making it easy for retrieval of data for analysis and reporting. For instance, you have a sample where you have critical results, and you need to check quickly whether this patient has visited before, 2 months, 1 week, 2 months, or a number of months before. You want to quickly check whether a certain analyte was analyzed before, and you check a specific value for you to compare with this critical value that has been released, to see whether you are going to either repeat, or we are going to check on the state of the patient, the clinical history or regarding this patient, for you to make a quick decision in order to ensure patient safety. So this is whereby the data accuracy and the efficiency of retrieving data comes into, because it can be a life-saving measure. This is also important, especially in faster turnaround times. In this, you also need to have streamlined processes and automated data transfer from analytical instruments to help in delivery of results more quickly. And this enables faster clinical decision making and better patient outcomes. There are some labs that have adopted interfaces even if you've not adopted interfacing, how have you streamlined data reporting? So we need to look at aspects across board, from small labs to big labs and big and sophisticated laboratories. No one is left out in this. So you have to do mapping for you to work efficiently. Integration and interoperability. Now we need to have seamless connections with the laboratory's instruments. Seamless connections with the hospital information systems and electronic health records. And we need to connect, we need to have a connection in these systems so that we can have a connected diagnostic ecosystem. Yes, and this is what I stated when I was talking of data accuracy and management, especially when you have large sets of data that are churned out of the equipment, and you need to handle this data efficiently for the safety of the patient, because here we are patient-centric. Now, how do we integrate this data for us to make decisions, to help even clinicians to make decisions? How do this data come out of the instrument? Do we print out the results and release the results the way they are to clinicians? Or we need this data is interfaced into our system? Or do we key in manually this data into the system for adoption into the system and releasing the results for clinician use? Or do we print out the results? Now, which system do we prefer for our own consumption? And what are the bottlenecks of this system, or a kind of practice? And what does it has to? What role does it play in data accuracy and management? So how do we ensure that this data integration is up to date? How do we operate within these aspects? We also need to consider regulatory compliance. Some bodies that have accredited us maybe as a laboratory facility, what do they say? They have a say in how you do your operations. Yes, for you to pass the certification, you need to follow what they say. Do we have features such as audit trails? Are you able to audit your sample processes or your analytical processes from the beginning to the end? Are your processes secure? Do you have secure access? And do you have quality control monitoring, which will help you to adhere to strict regulations like CLIA, CAP, ISO 151, 8922, or many others? We have SANAS, whichever level of accreditation that you are in. Now, even if you are not accredited, your lab has to become LTTP accredited. So at one point, you must adhere to certain regulatory compliance. That is a must, that you have to adhere to a certain level of compliance, regulatory compliance. So in this regulatory compliance, have you complied? That's the question. There are issues with advanced analytics, and this advanced analytics enables data-driven decision-making through customized reports, real-time dashboards, and the potential of AI and machine learning applications to identify trends and optimize operations. And this is for sophisticated labs, the labs that are a little bit more complex. like now we are analyzing certain parameters, let's say liver function tests. How are these results released into the system or by the system? There are various parameters analyzed in the liver function. How are they interpreted? Is there, maybe there, for instance, in lipid profile, which also has what we call indices that have to be analyzed. Like we need to check on the ratios between maybe HDL, cholesterol HDL. We need to check LDL. Is it calculated? Is it analyzed? And these other parameters, we need to check in liver function the ratio between AST and ALT, alkaline phosphatase and AST. These ratios, what do they imply in clinical laboratory setting? And how can this help clinician to identify a certain cause of problem, especially in a patient, to diagnose or to check prognosis on this patient that's being treated? Because such elements are very crucial in decision making. And do we customize this so that we enable our clinicians to work efficiently? Do we need to advise our clinicians on the best way forward, especially after releasing certain reports? So this is where AI is involved, because sometimes we can take a long time maybe in doing certain calculations so that we can input them into the system. And AI can help us to quickly analyze this data and report efficiently. Now, in clinical laboratory mapping, there are lean principles that we can use in medical labs so that we focus on maximizing value. And in maximizing value, we need to check on accuracy and the speed that we are releasing these results. And also by eliminating wastes, we eliminate delays, defects, unnecessary movements, unnecessary paperwork through process mapping. And we need to check on workflows optimization. We are going to check on 5S flows, and also we need to check on our continuous improvements in this matter. We are going to look at, in lean principles, we check on processes that lead to better quality and lower costs, faster turnaround times, improved patient care and streamlining every step, reducing bottlenecks, empowering staff to find efficiency. So in 5 flows, this is a chart that is clearly defining what 5S flow means. In these 5S flows, we need to check on 5 principles that will enable us to standardize our efficiency or to map our processes so that we standardize our efficiency. Now, in sorting, the first S is about sorting. Separate the needed items from unneeded items, and eliminate the latter. Just eliminate the unneeded ones. Second, in this process is setting in order. Keep everything in order. Keep needed items in the correct place. Allow easy access and fast retrieval. It can be sample storage. It can be records and documentation storage, whether it's manual or electronic. It must be set in order so that each and everyone who needs access can easily retrieve. You need to shine in your lab. Yes, this country, I've worked across board from very simple to very complex labs, and I've realized that there are labs that have problems. You need to shine in your lab. Keep your lab orderly. Keep the workspace swept and clean. This is first to increase efficiency, Secondly, to eliminate errors. Thirdly, to eliminate dangers that can be faced. If your lab is full of clutter and scatter, you will find yourself maybe stumbling upon maybe open needles and samples being stepped on and you crush them, samples falling on the ground, and so many dangers you will face. So we need to shine in our labs. Our labs needs to be orderly so that you know each and every space, what is supposed to be there, neatly arranged, clear, and everything is accessible at the fastest turnaround time. We need to standardize our processes to make sure that we create a consistent approach in which tasks and procedures are done. Our SOPs needs to be standardized. Our procedures, our operations needs to be standardized. From simple operations to complex operations, they need to be standardized. We need to sustain, lastly, we need to sustain all these processes. We need to build a habit, a culture of embracing all the processes that have been outlined. And these established processes are established and sustained through continuous encouragement, continuous training, and making sure people understand the essence of these processes. So in this we need to have workforce management in clinical labs. So it focuses on strategically managing personnel for efficiency, quality, and compliance. We need to cover everything from hiring skilled staff and smart scheduling of training. Yeah. You need to understand your staff, the staff that you are hiring. What are the competencies? And if they fall below bar, how do we train them? Are they trainable? Yes. So this is what you need to consider. Constant training and performance evaluation is key. And we need to also foster positive environment. Yeah. Positive environment so that people love their work. They love their workplace. When someone comes to work, either in the morning duty or the night shift, this person at least empowered mentally, embracing positive environment. You foster this positive environment at the workplace. So this one, as I said earlier, it doesn't involve physical work or physical tasks. It also involves soft tasks. And this is where positive environment comes in. We need to automate our tasks. Also, we need especially with the new technologies, we need also to ensure that we automate our tasks. Also, in workforce management, we need to look at key aspects involving balancing technology skills or technician skills with complex tests volumes, optimizing shifts, and managing diverse roles for lab assistants, ensuring continuous education, and using data for better resource allocation while meeting stringent quality safety standards. For instance, there are tasks that maybe medical laboratory scientists need to handle. However, these tasks are simple. They can be relegated to laboratory assistants. For instance, preparation of a peripheral blood film. Can you train these laboratory assistants to make a blood film? And can you train this person to stain so that your work remains analysis, examining this slide on a microscope, especially when you have extremely busy schedule that you are unable to handle certain matters. For instance, you are handling automated platforms in biochemistry. As a medical laboratory scientist, we're supposed to constantly check on quality assurance, laboratory automation processes, like calibration of the equipment. Do you keep involving yourself in sample identification, checking, sample triaging, and many other aspects of sample quality checks? This can be relegated to trained lab assistants who can help workforce management. We're talking of workforce management. What does our staffing look like? We need to match qualified staff, scientists, technologists, as also assistants to test complexity and workload. That's what I've stated before. We relieve workloads from certain personnel to engage those who can help, because they are well staffed and we have enough manpower so that they can help us as medical laboratory scientists to perform certain tasks, instead of us getting overworked and getting confused, especially in heavy workflows. Also, we can adopt automation in such workflows. We need to shift focus as medical laboratory scientists to higher value tasks. So we need to look at recruitment and retention. We need to attract competent staff and address challenges like burnouts. And what I've stated before can help us to reduce burnouts. And also, we need to create supportive environment to retain talent. Yes, those who are highly qualified, can we retain them? Can we help them at least to feel that they are really working for an institution that's caring for them? We also need to look at performance management. In this, we need to set KPIs, the key performance indicators. We need to use data analytics, such as laboratory information data, and process the improvement to enhance productivity and quality. This is where data can really help. We need to check on compliance and quality. Ensuring adherence to regulations, safety, quality standards, and managing accreditation processes. As I've said earlier, that the mapping process, the laboratory mapping process, is patient-centric. It helps us to be able to take care of our patient by having faster TATs. Why does faster TAT matter for patient-centric care? Yes, it matters because we have faster decisions and faster treatments. So it reduces the risk of diagnostic delays by allowing clinicians to start life-saving treatments sooner, especially when we have critical results and emergency care that is needed. And also, this reduces the patient anxiety. The shorter waiting time will significantly improve patient experience and also customer satisfaction. I've talked about patient portals, and these are very important because they will help us in communication, especially the patients are able to access health records. They are able to check even the appointments, management schedules. Yes, they can cancel their appointments instead of coming physically. They can bill for the tests and come straight to the lab for testing. Yes, they can also get educative materials here for them to learn For instance, the patient was sent for a certain test and you are given clear directions on how these samples should be collected. For example, samples for cortisols, 24-hour urine cortisols. Maybe the patient didn't understand clearly. You've not given a written document to show how the samples should be collected. You verbally did so. But if you had an automated platform that this patient can go to check, you can tell the patient, go and read in this portal and give the link. The patient will go and follow the instructions carefully instead of making mistakes, and the patient will be safe. You'll also be confident that you've received the correct sample. Now, there are benefits in this. For instance, for patients, there is more control over health, better understanding of conditions, convenience, and improved engagement. For providers, we have enhanced communication, better care coordination, and more informed patients. For healthcare systems, there is improved efficiency, reduced administrative burden, and better patient outcomes. So you see, there are a lot of benefits in patient portals if they are well managed or well designed. The benefit, now we are going to look at clinical laboratory mapping at point of care testing. Point of care testing offers major benefits like faster results, enabling quick diagnosis and treatment, which improves patient outcomes and satisfaction, while reducing lab workflows, costs, and unnecessary procedures. The key advantages are that we have quicker results and quicker treatment. There are some results that can be nearly instantaneous, like now blood sugar, that's for example. We have also improved patient outcomes. Faster care, meaning faster health results, particularly in emergencies like heart attacks, or patient diabetic ketoacidosis. Patient, for instance, diabetic coma. Are you able to save this patient? Yes, because we are able to obtain blood sugar tests very quickly. In heart attacks, we are able to obtain troponin very fast. Yes, we are able to obtain results for blood culture as soon as possible, or to check results that will enable us to identify sepsis as fast as possible. Tests like CRP and others that can clearly indicate sepsis, and the clinician is able to make quicker decisions. We have enhanced efficiencies, especially introduction of sample transport to labs. There's decreased lab burden, cutting costs, and streamlining workflows, especially for clinicians. There is also better patient experience, shorter waits, meaning fewer return visits, and this boosts satisfaction. This we've talked, I've explained in the past slides. The clinical mapping at point of care testing also leads to increased access to care. Yes, portable devices bring diagnostic to rural areas, clinics, and even homes, benefiting underserved population. Let's say there is a reference lab or a bigger healthcare facility. You are handling a large pool of patients from the referral centers, especially the outreach centers. Why don't you take point of care devices there for them not to keep on referring samples to you? And this, because you've mapped your facilities and you understand them, you understand their capabilities. Why can't you be able to to empower them with staffing and also give them point of care equipment. Yes, and also this improves quality. You cannot keep on sending hemograms to a reference or a major laboratory rather than doing them at the point of collection. Yes, we have so many wards, maybe in a big healthcare facility. Can you empower certain people, laboratory assistants, to be able to run a blood sugar efficiently and also calibrate this equipment so that they function well? So empower your patients also. For self-testing conditions like diabetes, yes, you can train them on how to use glucometers for self-monitoring. We can also support public health, right? Like real-time data from connected devices help to track diseases like spread of COVID-19. Yes, are you able to also interface your results from the patient you are handling who is at your care, and you're able to get these glucometer results into your system and make sure that they are customized for point of care testing at home. That these results, when you are checking the portal, you are able to know that this patient tested at home. These results were not from the lab. They were tested at home, so that you are able to monitor your patient well. So this is AI that is coming to play. We can reduce errors in ensuring that there's clear mapping. I've talked about AI, especially embracing technology in many of the aspects that I've talked about. Yes, this is very important for us to adopt. So there are 7 steps that we can create in order to map our processes. First, we decide on which processes we are mapping, and we write down the processes. And then we check on the types of workflows that we have, and to also map them. There is macro mapping, whereby we have an overview of chosen processes to determine from top to down without many descriptions or details. So we can check on very simple tasks. Then we have mini mapping, where we have the most popular. When we begin with the most popular when we are starting, then we get a we dedicate to a single organization level, such as team, department, and laboratory, etc. We also have micro, which is more detailed, a process of the mapping, which gives description of every process or on every individual level. When you are first starting, it might be useful to get help from someone who has already done the process mapping, because this will help to avoid some beginners' mistakes. This can either be a colleague or worker. Then step 2, make a list of activities that you are performing in the lab. Provide a list of all activities that are part of chosen processes and determine the level of details that you want to be included in the process map. There is here is a place where you assign a specific activity to a particular person or a particular personnel and place, so that you get the information on who does what, where it is done. It is important to note that this step is not focused on sequences of activities, but rather to prepare a list of all that is happening within one process. It is wise to include end users who provide the most accurate information and the details in this regard. So as maybe a lab manager or a lab superintendent, include the staffs who work in those stations, so that they can tell you what is being done in this station, or what can we include, and make a chart, a flow chart on what's going to happen here. Then next, step 3, you have to determine the start and the end of your process. Decide on your process boundaries and determine what triggers your processes and what is the result of the process. This will help to keep your processes map clear and understandable. Step 4, you put your activities into a sequence. So these activities, you have to put them in a sequence, like 1, A, B, C, D, so that they can be as in a flow chart. Then step 5, you draw the process map. Now it's time for you to describe the process. Step 1, what does process 1, where does the process begins? From point A to point Z. What does point A entail? What does point E entail? What does point X, Y, Z entail? So in this one, it can help people to understand how the work flows in a certain organization or a certain on a certain section of the lab. Here you describe the inputs and the outputs. Then you review your process map, and then you continue to improve and reevaluate your process map after designing that. So this is a simple workflow. That this is macro. And when you go to micro, is when, like now, you have various stations as described in this map, that you have to describe L1, what L1 entails, especially when you receive the sample, the details. You can give points on what the processes there entail. You can describe what L6 entails, especially in checking the results, what it involves, what are the parameters that we need to check after the results have been released from the system. Yeah, the integrity of the results and the quality control parameters. How are they critical results? What do we need to do the results? How do we need to report them? Is there any urgency? Yes. So in this mapping, we also need to look at, in this chart, we need to look at the pre-analytical, analytical, and also post-analytical. As you see there, there is pre-analytical phase where you receive the customer, the client, or the patient, and the sample is received, and the barcode is generated. Those are pre-analytical phases until L3. So L analysis maybe can begin on L4 or L5. Then post-analytical. How do you, after generate, now that one comes to L7. Now, all those processes are involved in mapping. All these phases, we understand them, the pre-analytical phase, as I've described it there. We have sample collection, labeling and accessioning, transportation, and also sample processing. The analytical phase involves testing. So you need to check on your workflows, each and every point of testing. How does it go? How are your calibrations? What are the quality control? So there are parameters that you have to check in analytical phase. Now, we also check on post-analytical phase, which is the last phase. This will focus on interpreting and communication of and archiving of results. Yes, the results have been released by the system. How do you interpret them? Are they critical? Do they fall within the reference ranges? And how do you communicate appropriately, depending on what has been released? Do you counter check with the quality assurance programs that you have, whether the results are accurate? What could be the errors? Yes. What are the bottlenecks of analyzing your samples? Are your analyzers working well, optimally? How do you archive your results? How do you archive them? The storage of your samples also is very important, because sometimes at one point you'll be forced to reanalyze a certain test, a certain analyte. How do you report your results? Is it manual or automated? How do you authenticate the results? How do you analyze the data? How do you report? How do you recommend? How do you calculate the indices? Are they automatically calculated from your system, or do you manually calculate, especially where ratios are involved and indices are involved that need maybe manual calculation, depending on the protocols in your lab? How do you store your data? Are they retrievable easily? Do you match the standards of patient confidentiality? Do you comply? Compliance checks or further analysis? What is your system like? So the roles in the clinical laboratory mapping, the roles and responsibilities must be well defined. Maybe they must be clearly defined. The phlebotomists, they have their role. The lab technologists have their role. The clerical or administration staff have their role. And also the labs with the laboratory assistants, they have their role. Are you able to train each and every person under you to be able to function optimally, efficiently, to map their processes efficiently so that you are able to perform optimally? So in conclusion, a good clinical laboratory mapping chart doesn't just improve efficiency. It supports quality assurance and regulatory compliance. When laboratory workflows are clearly charted and aligned with SOPs, they become a valuable reference for internal audits and external inspections, such as ISO 15189, SANAS, JCIA, and many others, and also team training. For example, a well-documented chart can help to verify the critical control points, e.g. sample integrity checks are always included in the processes. The results in sign-offs only being performed by authorized personnel. Yes, you check these points and you're able to document them very well. You'll be able to check every step. This leaves a traceable records, supporting both quality control and data integrity. So with the laboratory mapping, you are having a hawk eye. You are having eagle's eye view on everything that's happening in the station that you're working in, or in the entire lab for laboratory superintendents or laboratory managers. You are having a hawk eye on what is happening and the nitty-gritties of each and every step, so that you are able to perform optimally. You are not able to skip any step. This one will help you in audits. And when it helps you in clinical laboratory audits, especially the internal audits, then it means that you will be able to meet the inspection audits and you're able to pass your certifications very well. So this is my conclusion, and I really appreciate your audience. Thank you. Back to George or Bruce as moderators.
Thank you very much, Mr. Agri. I like how you just elaborately explained everything. Thank you very much. It's a wonderful presentation. And I think I can also confirm from the members, the expression is very, very positive about the nature of your presentation, very informative, and it's highly researched. And so at this point, I'd like to receive questions, reactions, or comments from the members. If you have maybe something that you'd like to just say, not type, maybe you can just raise your hand. Just tap the icon for the raise hand. I'll see it from where I sit and then give you the opportunity to speak. So if you'd like to speak, you have that chance, and it is your chance to speak. And if you'd like to maybe type a question, feel free to use our chat box to type the question or comment that you have concerning um, this session. As we move to that section for questions, it is important to take note that all the points for yesterday's webinar are all uploaded and certificates sent. Kindly check your emails and affirm that they are there. That's very important for those who are following up. And in relation to that, if you have any complaint, we are open to the complaint and we are ready to attend to them at any time. Just reach out to any of our WhatsApp admins, will be assisted. And if there's a form to fill, kindly make use of the links that are being sent to you so that you can give us the information and we act on them as early as possible. And those who also lodged their complaints, we have responded to quite a number. And if you have any complaint, just reach out to us. We'll see how to assist you. In that regard, feel welcome for questions. And quite a number are actually congratulating and they are appreciating the presenter of today and also the presentation. I can see John Wahome is saying perfect presentations. Yeah, there are very few perfect elements, but if John Wahome is able to identify your presentation as perfect, then it is perfectly done indeed. Samuel Newton is saying great presentation. Betty Kangogo saying that moving on well, that's very wonderful. Kennedy Kungu, well explained presentation. Michael Muinde is saying great presentation. Mr. Agri, quite a number are appreciating the presentation and they are acknowledging the fact that the presentation is well researched and is knowledge laden. And so this is very encouraging and we hope that the information and the knowledge gained from this presentation, our members, the participants would put them to practice and also research more on the areas that have been presented, just to ensure that you keep abreast with the developing knowledge and information that is within our domain. We are committed to ensuring that each and every laboratory personnel, medical laboratory personnel, acquires knowledge, acquires the competences, and is updated as far as medical laboratory practice is concerned. And so at this moment, I'd like to appreciate everyone for creating time and choosing to learn with us, gain knowledge with us as LMSK. We are very glad for that. And once again, to each and every participant, each and every medical laboratory practitioner on session today, we welcome you for we welcome you to our next session tomorrow. Tomorrow we'll have a webinar. And so as time goes, we are looking into ways on how we can ensure that for those who have not attained the required points, attain them so that you don't face any difficulty at the point of renewing your license. And so rest assured that we are doing our best and we are moving together with you. One important thing is to ensure that you reach out to your members, your colleagues. Some of them maybe might not be aware of the new developments. Tell them that LMSK, we are here for them, and we are here for them as well concerning the CPD points update. So at this moment, I would like to give this moment, this time to Mr. Agri, who has been our presenter. Just 30-second or 1 minute parting shot as we come to a conclusion of today's webinar. So, Mr. Agri, maybe you can just give us a line or just a statement or how you maybe feel towards today's session, or something that you can tell us as medical laboratory personnel, the officers that are here or who have managed to attend, or something that you can encourage us with. So, Mr. Agri, over to you. Kindly take the mic.
Thanks a lot, George. I really appreciate this platform, and also I'd like to encourage my colleagues for each and everyone to embrace efficiency in order to optimize their work at their workplaces, and also let us make sure that our labs are very neat and very well organized, because neatness and organization moves in tandem with clinical laboratory mapping, and same thing, just like efficiency and quality work. In my parting shot, it's not enough to be busy, so are the ants. The question is, what are we busy about? This is because you can be very, very, very busy and doing repeatedly things that don't matter, while you can be less busy and do extremely quality work. With that parting shot, may you be blessed.
Thank you very much, Mr. Agri. This is a wise quote, and it proves that you are indeed a wise man. It's not enough to be busy. So are the ants. The question is, what are we busy about? Thank you very much. Is a quote by Henry David Thoreau. So thank you very much. Our participants, on behalf of LMSK, we are really appreciating you for attending and moving on with us towards until the end of this presentation. Our presenter, we really appreciate your presence today, your dedication in ensuring that the content is well researched and knowledge laden, and with that, we are very thankful for that. So at this moment, allow me to bring this session to a close, being that time has caught up with us. And so at this moment, I wish each and every person a wonderful evening, and let's meet next time tomorrow, same time as today's session. Thank you very much and be blessed.